If you have long COVID, you may be wondering what you did to cause your condition. And if you're like me and you've been sick for a while, you may have even asked yourself what you're doing wrong. But is it your fault that you fell ill? Is it your fault that you're not getting better? Hi, everybody. Welcome back to Long COVID MD. I'm your host, Dr. Zeest Khan. I'm a licensed physician who's also a patient recovering from long COVID. On this podcast, we talk about how to navigate the healthcare system, get the care you need, and discuss the culture and influences that impact long COVID treatment and research. The idea that health is your own responsibility is called healthism. It's a term that was coined in 1980, and it's been the force behind the wellness industry and diet culture for years. It can sound empowering. You have control over your health, and if you take the right actions, you'll be a better version of you. But the flip side of this blames people if they aren't healthy. Now, healthism is showing up in public health policy. We're seeing it in the Make America Healthy Again movement, led by RFK Jr., the Secretary of Health and Human Services. He recently suggested that Medicaid benefits could be tied to acts of personal responsibility. We'll talk more about this in the episode today. We're also seeing healthism messaging from Dr. Mehmet Oz, the new administrator of the Centers for Medicare and Medicaid Services. Here's Dr. Oz speaking at his confirmation last week, saying that being healthy is an act of patriotism.
And it is your patriotic duty, I'll say it again, the patriotic duty of all Americans to take care of themselves, because it's important for serving in the military, but it's also important because healthy people don't consume healthcare resources. The best way to reduce drug spending is to use less drugs because you don't need them because you're healthy.
So what does Dr. Oz's comments and insinuations mean for people with long COVID? Will we be expected to prove that we're making the right lifestyle choices in order to deserve care? Are we going to be blamed or punished for not recovering quickly enough? I feel like there's enough of that happening already. And how do we push back when our healthcare providers carry this mindset into the exam room? To better understand healthism, I'm talking with Dr. Alyssa Burgart, a pediatric anesthesiologist and a medical ethicist. She's one of the most thoughtful voices I know when it comes to how medical culture impacts both patients and healthcare workers. She writes 2 newsletters on Substack, Poppies and Propofol, where she unpacks the ways ethics, culture, and structural power shape medical care for patients, and The Moral Injury Clinic, where she speaks directly to healthcare workers' trauma of practicing medicine in a system that often doesn't support them. In my conversation with Dr. Burgart, we review ways to identify healthism in marketing, on the news, and in the doctor's office. We also explore ways to push back. So without further ado, here's my conversation with Dr. Alyssa Burgart. Dr. Alyssa Burgart, thank you so much for joining me on Long COVID MD. I've been so looking forward to hearing your voice and having a conversation with you. Your background, your education, your bio is so broad and comprehensive. Can you please tell us about your career and your professional interests?
Sure. Thanks so much for having me. I've been really looking forward to this conversation. I'm a pediatric anesthesiologist and I'm a bioethicist. I tend to specialize in pediatric bioethics as well as issues pertaining to reproductive justice and disability justice. I was an ethicist before I went to medical school, and it's really informed every aspect of my work for my whole career. I love focusing on the way that ethics and culture really influence, I call it the house of medicine, that it's not just hospitals and clinics. It's the way that the ways that we have chosen to provide healthcare, how they influence real people.
On New Year's Eve, way back when, it feels like 5 years ago at this point, you wrote a piece on Substack called New Year, Same Toxic Wellness Messaging. And in that, you talked about this idea that was coined in 1980, healthism, which you say influences the wellness industry and even more now. Can you tell me and tell us what healthism is?
Yeah, absolutely. This concept of healthism is saying, if you if the primary and perhaps even only value that you hold up, and we all have values, and our values often, change. They can be quite dynamic through our lives. But when one focuses almost exclusively on health as the primary or only value that they're elevating above all other values, it leads to some very characteristic behaviors. And so, for example, when you hear people such as RFK talking about, it's your individual responsibility to be a healthy person, that is a manifestation of the idea of healthism. And so when it is all a personal responsibility, that's wonderful if you want to sell people things, because individual people are the people who are going to spend money. If you think about, for example, diet culture, it absolutely pervades medicine. And health and diet culture is really part of healthism. So this idea that if you just exercised enough, or if you ate the right amount of carrots, or if you switched to, celery juicing, or you ate the right supplement, then you would be able to achieve this idealized, often actually in reality unattainable standard.
It has really taken root in public discourse. Where else are you hearing healthism messaging?
I think you hear it in the doctor's office. One of my main interests is, of course, how it is that culture manifests itself in medical spaces, and how it is that medical spaces are oftentimes a reflection or an amplification of what we're seeing out in the rest of society. And it's because this idea of personal responsibility, which is part of healthism, is so pervasive. And it maps really well onto American idealism, this whole you're going to pull yourself up by your bootstraps, and you're going to be a one-person show, often a one-man show, and you're going to be able to do all of these things on your own with absolutely no support, which is itself a mythology. There is no person on this planet who has gotten where they are today with zero support from anyone. If you think about masking, right? Masking is something that is a personal responsibility. You're going to choose to wear a mask. You're going to choose to keep it on. Our society has chosen to make that even more of a personal responsibility by making it like DIY public health. So when we had, for example, mask mandates, which obviously were very challenging, became very politicized. We went from trying to have a community intervention where all the individuals were working in community to reduce exposure, to what we have now, which is you wear a mask if you sort of feel like it. And so it is also a personal choice, for example, to say, well, I don't want to deal with the negative social connotations of wearing a mask, so I'm not going to do it anymore. So when everything is a personal responsibility, you never take collective action. And that's one of the problems with healthism, right? It drives all of us to really focus inward, to focus on individual single-person choices rather than on collective action.
It's remarkable to me that we focus so much on you do you and your outcomes, whether that's your health, whether that is your kids, being well behaved or well raised. That is all connected to what you have chosen to do. And yet there are social determinants of health. We do work and live as a collective. Can you talk about social determinants of health and how even obesity isn't all due to one person's individual choices?
Yeah. I'm so frustrated in a lot of ways by the MAHA movement, the Make America Healthy Again, because it's such a great idea. Fabulous marketing. It's created really interesting coalitions. People who are interested in climate, people who are interested in health. It's gotten a lot of moms involved. Moms are a really important coalition. In particular, it's gotten a lot of white women involved. And what's really frustrating is I'm watching that group, in my opinion, squander the coalition that it's built by focusing on things that are much more akin to individual behaviors or to things that aren't really going to move the needle. And so when we think, for example, about the topics that you just brought up, so if we think about complaints about obesity, when we think about what are our responses to those things, I'm not seeing people in the MAHA movement be like, wow, food deserts are a real problem. And that's not new. We have known about food deserts for a long time. And these are areas where there are no grocery stores. So if you want to deride somebody for eating what you call, not you personally, but like you say, oh, people are eating all this junk food because they're making bad choices, that implies that there are choices to be made, as opposed to the fact that we live in the environment. Can you walk to a grocery store? Do you have access to food? Do you know how to cook? You have generations of folks who really don't cook at home for lots of reasons. They're working multiple jobs because they're trying to make ends meet. And so, yeah, you're going to put what's easy on the table for your family, as opposed to perhaps something that might be more nutritious or might be more delicious, frankly. And so I think these things are really complicated when you think about the amount of pollution that our communities are exposed to. Your zip code can determine like how many toxins you're exposed to. Yet then we say to populations of people who have low access to resources, who have high levels of pollution exposure, who are in underpaid jobs, poor working conditions, underfunded schools, and we say, well, just figure it out. What's the problem? Pull yourself up by your bootstraps and go buy a carrot.
Yeah, a carrot's not going to solve the problem of a highway bisecting your neighborhood. We know that asthma, for instance, is very connected to traffic near you. And people and children who live near freeways in particular are more likely to develop asthma. And then that becomes a chronic condition that is not necessarily caused by one choice that was made by an individual person. So let's talk about the ramifications of this, because you mentioned Robert F. Kennedy Jr. He is the current Secretary for the Department of Health and Human Services. There was a recent Washington Post article, and I want to read a blurb about RFK Jr.'s recent interview with a CBS reporter who is actually a physician. And in that conversation, he discussed how personal health choices might influence the medical coverage that you deserve to receive. That article was published on April 10th, and it's entitled, "If You Eat Donuts or Smoke, Should Society Pay for Your Health Care?" RFK says, if you're smoking 3 packs of cigarettes a day, should you expect society to pay when you get sick? Though Kennedy did not explicitly suggest limiting Medicaid benefits for those engaging in behaviors deemed unhealthy, his comments could be interpreted as such. And this is the part that I found really interesting and possibly, something we might see again. It reads, West Virginia limited Medicaid benefits in 2007 if patients did not follow healthy behaviors and sign a personal responsibility agreement. Federal approval for that was withdrawn following Barack Obama's election. Alyssa, what do you think about RFK's ideas and insinuations? You've mentioned it already, but you see healthism pervasive in the MAHA movement. What are you going to be paying attention to when it comes to policy from the Department of Health and Human Services?
I think that we are entering an era where we are going to see a lot of responsibility put on individuals to overcome massive systemic influences that are essentially invisible to them. If you think about, when you and I were kids, there were still advertisements of, camels smoking cigarettes and all of that stuff, and there's legislation and public health interventions that have been made so you can't advertise that way to children anymore for smoking. Those are public health interventions. Those weren't interventions to say, well, if you're a child, don't look at those advertisements. So it's incredibly upsetting to me to hear people with an immense amount of authority, an outrageous amount of authority, to use their platform rather than to drive systems levels interventions that would improve the lives of millions of Americans, to instead use that as a platform to say, you know what we're going to do instead? We're going to blame and shame you. And in fact, the underlying assumption, the underlying thing that if you make these, quote, choices as though these choices exist in some sort of a vacuum, that you're making these decisions that you're not worthy. You're not worthy of care. You're not worthy of attention. You're not worthy of resources. To moralize those choices is a mistake.
This idea of morality as it pertains to health comes up so often, and it is very evident in the chronic illness space, in the long COVID space. We love a story of the self-made man, of making choices is why I am healthy. The choices I have made protect me from harm. And that means if you have been harmed and if you are not healthy, then it's because of some choices that you've made. And even, yesterday I was scrolling social media and there was yet another person with long COVID and a pretty large platform who said that, she is close to being recovered. And what she notices about others who are recovered like her is that they have the right mindset.
If only that's all it took, right?
Yes,
great?
It would be fantastic. And yet we know that those of us who have long COVID or any post-viral illness got sick because we had an infection. And maybe there's some predisposing factors that led some of us to get more sick for longer than others. But certainly that's not because of our mindset. So how then?
It's a fantasy.
It is a fantasy, but it's so influential.
Well, and this is healthism, right? So this is a manifestation of this very same idea, because if your number one value is health, then every single choice you make must be in alignment with that value. And if you act out of alignment with that value, you are morally corrupt, you're bad, and it's your fault. And it's a perfect example of how it shows up in our discourse around COVID, around all sorts of infections.
There are people who've gotten COVID who have masked regularly. And there are people who have gotten COVID who have been out in the club. Things happen regardless sometimes of the decisions that you make yourself. Hi, it's Narrator Zeist. I'm popping in to clarify what I said here about masking. I'm not minimizing the efficacy of masking. Wearing a high-quality mask in public spaces absolutely reduces your risk of contracting COVID. Unfortunately, it's not 100% effective for prevention. And my point here was that even if you're putting lots of effort into trying to prevent a bad thing from happening, sometimes a bad thing still happens. That is true for our health and true for lots of other things in our life. My clubbing analogy is kind of trite too. Public health agencies said being out and about is safe. So what's wrong with people going out clubbing? We're seeing masking also being discouraged or even penalized. So is it totally the fault of the individual that they contract COVID? Does someone else get full credit for not contracting COVID? Should treatment be dependent on the way we contracted COVID? Who deserves care here? Okay, Narrator Zeist dipping out.
It's a great example, right, of if the club had amazing air filtration, maybe we could all go out clubbing and be fine. And maybe there would be, again, systems level interventions, system level investments in our structures and in our society. This idea that this is solely an individual responsibility is part of what's driving so much of the discourse around infectious disease and why it's been so easily politicized.
Talk to me about the ways healthism invades or impacts the clinic office or the hospital interaction. How are healthcare workers influenced by healthism, and how does that impact the patient care provider relationship?
Absolutely. I think that this is where it gets to sort of the culture of medicine. I think a lot of times as clinicians, we understand people are coming to us for answers. I think sometimes we have a hard time saying, like, I actually don't know. I think that when clinicians don't have an answer, there is a risk of what can happen is the soup of society, the magazines, the things you see in the newspaper, the things that are being talked about in your community can show up under the veil of authenticity, under the veil of expertise.
Yeah.
When all of the solutions that are immediately at your disposal, faux solutions, are all based on individual behaviors, then I can blame you. I can say it's your fault. And we see this in lots of chronic illness. The number of conditions that are blamed on individual anxiety, of course, long COVID is fitting into a long and sordid history of people with genuine illnesses being derided and being treated as though their lived experience is totally not only invalid, but not useful information, which is weird because it's one of the first things you learn in medical school is listen to the patient. I was just teaching all of our medical students get a certain amount of ethics educational time, and yesterday we were taking them, my colleague and I were taking them through some cases before they head off to their clerkships, and we'd give them a case and we'd say, okay, like what are some of the things that you want to know? And any time that a student said, I would ask the patient XYZ, we would like applaud, because I would be like, there's only one thing. If there's one thing that you learn today before you go to your clerkships, it is to listen to the patient. Ask the patient. You are trying to take the information that you get from the patient and put it in that big, beautiful, educated brain of yours and try to make sense of it. And if it doesn't make sense, that doesn't mean that it's garbage information.
So that part, because we have a tendency, and I'll put my doctor hat on or coat on, we hear the information and we don't know how to categorize it. And immediately not immediate, it happens immediately once we are in practice after a while. But clearly we have been programmed, trained. This has been trained into us. That's the mental problem category.
It's the hidden curriculum.
Tell me more.
Hidden curriculum. William Osler, amazing, early leader in medicine, sounds like was an incredible clinician. And yet this idea of equanimity, that it is your job as the clinician to sort of remain, unmoved, is a problem. I teach residents and fellows, if the patient cries, you are quiet, you are supportive, and you let them do it. But if you start talking while someone is crying, you are missing the point. And if a patient tells me something that doesn't quite make sense, I have really tried to train myself to say, okay, but what if that's true? What if they're right? Maybe they're not right about the whole thing, but that's why they're talking to a doctor, because they're trying to figure it out. But what if they're onto something? And it's amazing to me that in a medical culture that is supposed to value lifelong learning, so many things have changed. Even if I just think about drugs that we didn't have when we were in residency that we have now, you constantly have to learn new things. And if you don't, your patients suffer. And yet it is a lot of work to keep up with the times. But you have to be able to do it. So it's tough.
Yeah. And, it is our responsibility to keep up, and it is our responsibility to continue communicating, because what I also recognize as a cause or a contributor of this chasm between healthcare providers and patients is that we are not recognizing the cultural shifts and the communication shifts that are also occurring, that just like medications, we have to remain updated with and bring with us as part of the tools that we can offer. This seems like such a big and, again, pervasive issue. How do we push back? First, how do we recognize when we might be being manipulated by healthism messaging? And then how do we try to influence our healthcare providers who might be influenced by healthism or demonstrating healthism bias towards us, especially when there's such a power imbalance in that relationship?
I mean, one thing I think you can do, for example, when you see an advertisement or you're listening to, a speech by somebody, is asking yourself, okay, was that something that was about an individual or is that something about collective action? And simply recognizing that and training yourself to think about that, because the default mode, I would argue, in most of our discourse is focused, because it's focused on individual actions and individual behaviors. Just asking that question and noticing it is really powerful. And the other thing is, I think that when we are talking about health issues, it's when we think about people who are smoking, for example, if they get diagnosed with lung cancer. I have a friend who was recently diagnosed with lung cancer. She's a non-smoker. One of the first things that she'll say is, I was never a smoker. But of course, there's lots of kinds of lung cancer that have nothing to do with smoking. And there's lots of people who smoke a significant amount of cigarettes who will never develop lung cancer. But the reason that people say that is because they don't want to be blamed for having cancer. And the idea that we would say, well, you smoked, so it's your fault. Like, I don't want to be in that conversation. And so I think that if you notice people being blamed, and let's just say you're observing it. Sometimes it's easier to see it happening to someone else than to yourself. Is to say, oh, could you repeat that? It almost sounded like you were blaming them for having cancer. Because I don't think that many of us even realize what we're saying. If you haven't thought through what it would be like for that information to land, it's really painful. And I don't want to treat other human beings like that, and yet I know that I have absolutely blamed people for their illnesses. And it's like trying to untrain yourself to do that. It is a garden that needs tending, because we are surrounded in a society where that is quite often the norm. For folks who are dealing with clinicians, whether it be physicians or nurse practitioners or dietitians, whatever interface that you're having, it is really hard with the power dynamic, and so it can be really challenging. Sometimes people will be like, well, if you don't feel good about your clinician, you should just get another one. But that's also not easy. And a lot of clinicians don't take well to being criticized. And so I think these are, I wish that I had some beautiful little tied up in a bow solution. I do think that you can practice or try saying things like, it almost sounded like you were blaming me. Was that what you meant to say?
It's hard to do when you're in that situation. Let's flip it. What do you want clinicians and doctors to know about the ways that they have been impacted and are bringing this judgmental health idea to their patients' interactions? What do you want them to know?
If I had my way, every healthcare worker in America, because that's what I know best, would learn what trauma-informed care is. I think that there is such a under recognition that hey, the terrible things that happened to people in their past, they are showing up in the clinic whether you like it or not. If I'm taking care of a patient who has had a lot of medical care in their life, they're highly likely to have some medically induced PTSD, for example. It's not that I'm going to go in and I'm going to probe everybody's trauma and unroof everybody's terrible experiences, but simply recognizing and practicing the awareness that these things show up allows me to be curious rather than judgmental. To say, wow, what happened to you that has led to this constellation of events and symptoms? Not what did you do? What's wrong with you? Like, what's wrong with you is the wrong question. It is the wrong question. It is what happened to you, and how can I best support you moving forward?
Do you find doctors asking themselves what happened to me that I am bringing this to my job?
That is one of my missions in life. It is part of why I started writing the Moral Injury Clinic newsletter. I talk with all of our trainees about, listen, like, these jobs are hard. Even if you have like a perfect childhood, you have no adverse childhood experiences, whatever, your life's been absolutely phenomenal, and then you become a clinician. We live at the interface of human suffering. Like, you cannot be in these roles and not be changed as a person. And it's not always in good ways, you know? I just gave a lecture. I was really, really honored. I was asked to give a lecture to all of the gynecologists in the Veterans Administration healthcare system. And they wanted to talk about the impact of basically taking care of traumatized patients and how hard it was for them and how could they do a good job. And it was such a wonderful and beautiful thing to be asked. And the way that I framed the talk was like, you're in this talk too. You cannot take care of people who are ill and dying and having the worst days of their lives. You cannot have this experience and not be part of this issue. And that's why I talk about moral injury, and it's why I talk about things like PTSD and the interface of those issues. It's why I talk about the physical manifestations of moral distress and moral injury, because these are features of what we do. These aren't like accidents that we can somehow like get out. They are part of the work, and we have to be able to attend to our own suffering and in community attend to each other's suffering through connection in order to be able to take great care of patients who deserve our best work.
Absolutely. I am struck more and more as a patient now that the other factor is that we were not trained in a way that was right all the time. Like, there are big things that need to change. Yeah. And not only in addition to our own trauma, our patients' trauma, we also are not taught the best way to navigate it. Dr. Alyssa Burgart, you gave us so many ideas. I've learned so much today. As we wind down here, is there something that we missed that you want the listener to know?
I think for people who are patients, and of course, as you know, physicians can be patients as well, you deserve great care. You deserve to be taken seriously. You deserve to be able to find healthcare providers who are going to treat you with dignity and respect, who are going to take your ideas about what's going on and try to synthesize that into something with the evidence that we have or the evidence that we need to find. And I would say for, any healthcare workers who are listening, who want to be better versions of themselves and bring their best selves to their patients, I really urge you to learn more about trauma-informed care. I would say it has revolutionized the way that I approach every clinical encounter, and I'm embarrassed to say that there were so many years that I had never heard of it, or I didn't feel empowered to use it because, like you said, we're not all taught very well how to do these things. Even in organizations that are trying to change medical education, even in progressive teaching spaces, like, there is always going to be more to learn, and it takes a lot of vulnerability to admit that you don't know. And it takes a lot of vulnerability to really deeply listen to your patient and say, wow, I don't know how to fix that, but I am with you. And I am going to keep seeing you, and we're going to figure out what we can do together. Obviously, that has to be paired with, helping to try to find solutions. But, when you think about, COVID, long COVID is still such a new area of research. what has struck me about long COVID in particular is post-viral inflammation is not a new idea. We've seen that in lots of illnesses. But we seem to be acting like this is something we've just never seen before, as opposed to the fact that it's just that we haven't been taking people seriously for a long time.
Thank you so much for joining me. I'm so glad that we got to connect.
Me too.
That was Dr. Alyssa Burgart, and I hope this conversation gave you as much to think about as it gave me. As we've seen, healthism is more than a wellness trend or a passing talking point. It's a powerful cultural force, and increasingly a political one. We see these in the words of the head of Medicare and Medicaid Services and the Secretary of Health and Human Services. They are both suggesting that people with unhealthy behaviors are potentially unpatriotic or irresponsible. In fact, those who are unhealthy may not deserve full medical coverage because they are to blame for their illness. For those of us living with long COVID, this raises really difficult questions. Are we going to have to prove that we're trying hard enough to get better, even when there are no FDA-approved treatments for long COVID? Are we going to be penalized if we don't fit someone else's idea of compliance, even if they're asking us to try treatments or continue treatments that are not working for us? If we are sick for longer than expected, defined by who knows who, is that going to be seen as a moral failure? And importantly, are we going to be limited in the healthcare services we can access? These are questions that are worth asking, not from a place of fear, but from a place of preparation, because we all deserve a healthcare system that recognizes complexity, that honors our lived experience and supports us as we are, not just the versions of ourselves if we were better. If this episode resonated with you, please share it with someone who needs to hear it and leave a positive review if you feel up to it. You can find the links to Dr. Burgart's work and to Long COVID MD in the show notes. That's all for today. Until next time, bye for now.